I'm joined here by Dr. Eoin Feeney from St. Vincent University Hospital, and he is a consultant in infectious diseases, so thank you very much for agreeing to participate in this. It's just to get your understanding of what is patient experience and how does it differ to patient satisfaction.
So I suppose patient experience is a more objective view of the overall flow through the process. That's the way I would look at it, as opposed to say patient satisfaction, which is a view of how the patient feels their stay in the hospital went. Whereas the patient experience looks at all aspects of the patient's stay in the hospital, the communication, their comfort, their quality of their care as perceived by the patient after a period of reflection when the surveys fill out after the patient's been discharged, as opposed to the more subjective satisfaction and overall happiness with the patient's stay.
So what do you see as the benefits of gathering this information on patient experience?
I think there's a number of benefits. I think number one, it lets us know how we're doing and how it gives a different set of eyes, a different viewpoint. What we view as a good outcome and as a good patient experience may not be the same for a patient. The second thing it allows us to do is allows us to compare how we are comparing to other hospitals within in similar size and similar acuity, both within Ireland and internationally. I'm not aware that this study's been done in Ireland before. So it should give us some tools to look back at what we provide for patients and how they experienced our transition through their stay in hospital, and how we can better serve them, I guess.
And I suppose, how might you use this information in your work as a consultant in infectious disease?
Well, I suppose one of the things we might do is we need to communicate with our patients quite regularly. A lot of our patients have chronic infections, chronic illnesses, are on treatment for lifelong, for the rest of their lives in some situations. And we may think we communicate very well, and I would hope we do, but patients may have a different experience, and they may be able to tell us that what we do well. Learning what we do well is just as important as learning what we do not so well in. And feed in ideas they may have around how this could be improved, how their patient's experience could be bettered through a different set of eyes, and what's important to them as well, what they feel is important in their stay in hospital, again, which may not marry with what we feel is important.
Okay, very good. And I suppose, what improvements do you expect to see as a result of collecting this type of information on patient experience?
Again, I would expect to see a better understanding of the way the patient experiences their stay, and areas that we can really focus in on and improve on. Particularly I think for medical doctors and providing care around communication of patient results, around counselling, around patient illnesses, medication management, how patients can better use their medications and potential side effects, and other ways we can improve their time in hospital.
And do you think the patients will see the benefit of collecting this information?
I hope so. The patient-doctor relationship, or the nurse-patient relationship, is a two-way relationship, and patients care, and we really need to hear feedback on what we do well, what we do badly, so that we can actually focus our efforts on improvements and kind of consolidating what we do well. So I think patients will see the benefit of filling out these forms and providing the feedback that we need.
Do you collect that type of information currently? Do you get that type of feedback back from patients?
We do get feedback. I don't think we get it at such a thorough level. I think we get feedback when things go very well and when things don't go very well. But I don't think we get an overall view of what patients as a whole feel and what they feel their experience is like. So I think if you focus on the things you do very, very badly and the things you do very, very well, you're going to miss a lot of the general patient experience. So without a systematic attempt to collect this information, which is what this patient experience is, we're not going to get a good overall view.
Great. Thank you very much, Dr. Feeney.